Thank you, Brian, and thank you for being a loyal customer, and I guarantee you we'll keep you as a loyal customer. Although Blue Cross Blue Shield is headquartered in Boston, we feel to be a central part of the greater Worcester community. We have a team of 30 Blue Cross associates who work around the corner from here, and another 30 who work in the region remotely. We cover 2,600 separate companies here in Worcester County that insure over 180,000 members, important members to us. And over the past 5 years, we've contributed more than $1 million to 63 Worcester community organizations through our corporate sponsorships and foundation grants. My own history in Worcester dates back actually to 1983. When I worked for the state and was part of a 6-month investigation which sought to improve mental health services both in the city and the region. And there I met so many great leaders of this region, and I'm pleased to have so many friends in the audiences, people like Mo Boisvert, the former CEO of U Inc., and John O'Brien, the former CEO of UMass Memorial. I don't know what it says about me that all my friends are former CEOs. So what I want to talk to you about this morning are three trends in healthcare that have the potential to reshape how we think and experience healthcare both in Massachusetts and around the country. Taken together, these three trends I'm going to discuss have the potential to put us in reach of what I call the holy grail of healthcare: higher quality at lower costs. And we start here in Massachusetts with a very strong foundation. We have nearly universal coverage, the only state in the country that can claim that privilege. We have an extraordinary network of academic medical centers, community hospitals, physicians, clinical groups, many right here in Worcester. We have the highest rated health plans or health insurance companies in the country here in Massachusetts, including Fallon right here in Worcester. And we have scores of companies that are advancing biotechnology and the development of new and better drugs, and I know how important that is to this region's economy. We were also the first state to set an actual cap on what we can spend on healthcare in Massachusetts under a new cost containment law that attempts to delicately balance government oversight with market innovation. But we have a long way to go to get to that holy grail of better care that's more affordable for you. Because healthcare costs continue to be a burden for individuals, for families, for employers, and for government. We can and we must do better. So how do we solve this problem together? How do we reach for that holy grail? Well, these three trends I'm going to talk about, if we execute them right, if we get them right, I think can put that holy grail in reach. So what are they? The first is we must reorganize healthcare around the needs of patients and consumers. Second, we have to fundamentally change the way we pay for healthcare in this nation. And third, we have to turn the tide on chronic disease. So let me talk about that first one, reorienting healthcare around the needs, around our needs as consumers and patients. So imagine this scenario, you've all been there. You go to your primary care doctor, you have a medical complaint. They say, I'm concerned about this. They send you to a specialist. You go see the specialist says, I think I may know what's wrong, but I need to get a few tests. Each step of the way, there are different forms to fill out, almost always in paper, questions to answer. Then it's time for a procedure. Where should you get it? Should you get another opinion? How do you know who the best is at that procedure? Come to think of it, who's in charge of your care right now? Is it your primary care doctor? Is it your specialist? Is it you? And then suddenly the insurance side of the experience comes in. You want to know what's covered and how much are you going to have to pay for it? Do you have a copay, a deductible, a coinsurance? Eventually you get something in the mail from a company like Blue Cross that says, this is not a bill. And have you seen that? Yeah, more confusion, not very helpful. So think about it for a second. You're in Prague, Czechoslovakia, it's 10 o'clock at night. You can go to an ATM machine, withdraw cash, find out your account balance. Back at the hotel, you can go online and book a cruise on a river. You can pay your credit card. It's simple, it's transparent, the technology is accessible, it's easy to use, it's designed to meet your needs anytime, day and night. Why not in healthcare? Instead, we have this complex, fragmented system organized around the needs of institutions and professionals, not around the needs of individuals, consumers, and patients, and that has to change. At Blue Cross, we've decided to reorient our business to deliver a new kind of consumer experience, one where financial protection, service, and health outcomes of our members are much easier to come by. Imagine, for example, on your smartphone, there's an application that tapes you step by step through the decisions about your care, the cost, the quality, the outcome information for doctors, hospitals, and other providers, plus online support and a phone center where you can get in touch with a real person who can help you navigate this complex system. How about if you went to a lab or a specialist's office, you showed your Blue Cross card, which might be right there on your smartphone, and it could immediately tell you, how much is this going to cost me now? How does this apply to my deductible, for example? Or what if rather than getting that this is not a bill, you got a nice, clean, simple monthly statement that told you exactly what you spent, exactly what we paid, and exactly what you're responsible for. You get that from your credit cards, you should be able to get it from us. Now, to create this reality, it's going to take a lot of collaboration among health plans, among hospitals, physicians, and government. It won't be easy, but it's a vision we're committed to delivering. In fact, we already have gotten started. So we have mobile apps that can help people manage their weight, healthy eating, exercise tracking, smoking cessation, remind people about their medication, help with controlling diabetes, or tracking even complex medical issues like fertility, with many more to come. We're sponsoring a pilot right now with about 100 physicians at 4 groups in Massachusetts to test the use of video in primary care. We want to see if this idea of telemedicine, as it's called, can increase access to care when you need it, reduce unnecessary and expensive emergency room visits, and free up clinician times for more complex care. These are just a few of the ways we're going to use web-based technology to make healthcare more consumer-friendly and patient-centered. There are barriers. The biggest, perhaps, is confidentiality and privacy, something we take very seriously, but we have to tackle it. But we're not going to get there. We're not going to be able to deploy these new technologies in healthcare unless physicians and hospitals are paid in ways that give them the flexibility and innovation to care for their patients the way they see best. So that takes me to my second trend, to change the way we pay for care. So for 75 years in healthcare, we just celebrated our 75th anniversary, so we're a young'un to this group. 75 years we've been paying one way in healthcare. It's called the fee-for-service. We pay for activity, for a visit to a physician, for an admission to a hospital. Every test and procedure we pay. The more tests, the more we pay. So we're paying for the amount of care, not for the quality or the outcome of care. So imagine for a second there's a primary care practice at St. V's or UMass or Reliant Health, and they're doing such a good job managing a patient with a chronic condition like congestive heart failure, such that they're able to keep them out of the hospital for a whole year. What's their reward? We pay them less. Now then, what happens if they don't do a good job managing that patient? The patient's repeatedly admitted to the hospital. We pay them more. And what happens if at the hospital they contract an infection that could have been prevented? We pay them even more again. Isn't that backwards? Shouldn't we be paying for results, for quality, and for outcome, not just for tests, procedures, and activity? So that's what we challenge ourselves to do, and we invented a new way to pay for healthcare. We gave it a name that if we ever knew it would have been so influential, we never would have given it. It's called the Alternative Quality Contract. If we knew that it would become the prominent and influential way to pay in healthcare, we would have given it a name like Blue Sky or Blue Breakthrough or Blue Innovation, because in our system, everything's blue. But it started small and it moved so fast that the name stuck. And so under this model, rather than giving physicians and hospitals incentives to do more, we give them incentives to do it right and to pay them more and pay them bonuses when they elevate quality and produce better outcomes. Rather than fighting every year or two with hospitals and physician groups over the price of what we pay them, we enter into long-term, sustained, up to 5-year partnerships where we're mutually committed to each other's success. And then we provide data and support to these groups so they can practice at the top of their game. Now, 85% of the primary care doctors and medical specialists in Massachusetts embrace this new payment model, many enthusiastically, and it works. We hired independent researchers from Harvard Medical School under a grant from the Commonwealth Fund, and they've had 2 years published. The next 2 years will be coming out soon. The results are clear. Quality is up and costs are down. That holy grail is in sight. So what happens when you kind of unleash the creativity of physicians and hospitals, and you take them away from this fee-for-service system that just has them spinning and spinning and spinning? They redesign care. So one large community hospital set up a special team to evaluate patients who came to the emergency room to determine could they care for them in their offices and keep them out of the hospital in the first place. And then if the patient was admitted, they immediately went to work, starting to organize and plan for the discharge of that patient so when they're out, they have the care they need. One group was so effective at that they had no more admissions for a chronic condition for an entire year. Other physician groups have experimented in different ways. Several have brought social workers right into the primary care practice because we know that mental health and substance abuse is a complex problem across all our communities, and having a social worker embedded in the practice is making a difference. At UMass Memorial, which joined this new payment model last year, they're working on their patients with chronic condition, not waiting for them to come in with a complaint, but actually reaching out to them to say, can we identify the problem earlier and intervene earlier? Which brings me to the third trend that we need to solve this problem, and that's to turn the tide on this rising issue of chronic disease. So we have an epidemic of lifestyle disease in the US. Diabetes, heart disease, and obesity are all on the rise. And 3/4 of chronic disease can be tied to lifestyle risks and behaviors like poor diet, physical inactivity, and tobacco use. At Blue Cross, and this would be true for our friends at Fallon or Harvard Pilgrim, which are also here today, 5% of our members account for half or 50% of our spending. And 1% of our members account for about 25%. And yes, there are a few organ transplants and traumas and premature infants in there, but by and large, these very expensive patients have multiple chronic illness that we could have treated earlier and prevented them from staying out of that 5% and giving them back a much fuller life. So to turn the tide on chronic disease, we're collaborating with our members, with our employer customers, and with physicians and hospitals on new approaches to wellness and disease management, focusing less on what happens in the doctor's office and more what happens outside in people's homes, in their work sites, and in neighborhoods. Many of our employer customers are introducing new workplace wellness programs to reduce health risks, help employers lead healthier lifestyles, and over time, lower the cost of their insurance. We have wellness experts across the state who are customizing interventions depending on that particular employer's prevalence of lifestyle risks in the workforce and the medical costs associated with them. So in the city of Worcester, one of our wellness experts, Amy Higgins, collaborated with the city's human resources team on a comprehensive campaign that focuses on 3 specific health risks they identified: poor exercise, smoking, and unhealthy weight. The city uses our customized wellness website to promote healthier lifestyle features, and they have features like walking maps around municipal buildings. They've held blood pressure, cholesterol, and blood glucose screenings at police and fire stations and other municipal buildings. And there's a healthy financial incentive for the workers as well. The City of Worcester subscribers and their spouses can earn up to $200 each for completing a health assessment and 2 wellness programs during the year. What about our members who already have chronic illness? In addition to the great work of our physicians and hospitals, at Blue Cross we have our own team of nurse case managers who reach out to these members, identify gaps in their care, coach them on healthy lifestyles, connect them sometimes with their own physicians and other community services, and make sure they maximize their insurance benefits. We want our chronically ill members to use their insurance benefits, to take their medications, and to get the care they need. So in an environment which is changing so rapidly, and I heard it at the table, there's no field that seems to be moving faster than healthcare. These three trends, I think, have the possibility of really transforming healthcare. Organizing care around the consumer, changing the way we pay for care, and turning the tide of chronic disease. But it's going to be a challenge, and there's a paradox in all this for us, because we are just seeing every day astonishing advances in medicine. Right here in Central Mass and across the state, we have some of the best medical researchers developing new therapies and cures that were unimaginable even a few years ago. Many of them cure chronic illness or grave and medical conditions. And we're all going to want them for ourselves, for our family, for our workers. And we'll want health insurance to cover them, but we have to pay for them. One example that's been in the news lately is a first-of-its-kind drug called Sovaldi. It offers a 90% cure rate for hepatitis C, something we've never seen before, a disease that affects 2.7 million Americans. It costs $84,000 for a 12-week course of treatment, $1,000 per pill. Well, no one wants to prevent anyone who has hepatitis C from getting this needed treatment. But in the first 3 months of this year, Blue Cross's bill for hepatitis C medicines went from $3.5 million last year to $28.5 million this year. It's a big challenge. That's an 8-fold increase. And this is just the beginning. In the pipeline are a number of cures for other chronic illnesses, for cancer, for MS, for serious illnesses we want treatments for, and we want our patients and our members to live healthier, happier lives, and reduce need for future health services, but it's going to be a challenge. So we have hard work to do. If we're going to pay for these extraordinary cures that are here today and will be with us tomorrow, we have to act differently. The healthcare system has to change. And what I want to suggest to you today is if we as a community unite around these imperatives of organizing care around the needs of patients, of changing the way we pay for care to reward quality and outcomes, and turning the tide of chronic illness, we can accommodate these new treatments and we can pay for it and have the kind of care we want and need. So I'm proud that Blue Cross has been a leader in this area and an innovator during this time of extraordinary change. We're only one part of the puzzle. We know that sustaining and building on the gains our state has made will take collaboration. That's why it's exciting to be here with you today in this community, this Worcester community that pulls together around these issues. We have so many pieces in place. We can have the health care we want at an affordable price. Together, let's make it happen. Thank you very much.